everyone. I hope you all having a wonderful day. My name is Nida Mariam, and I'm the coordinator of Alfaisal MedHub under the International Office at Alfaisal University in Riyadh, Saudi Arabia. I'd like to welcome you all to yet another exciting webinar under the Career Guidance Series UK. For those of you who don't know, Alfaisal MedHub is an initiative under the umbrella of International Office at College of Medicine that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about their career opportunities available after graduating, as well as the steps that are involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance Series addresses this challenge from the perspective of accomplished and experienced seniors. As you all are aware, we are now conducting the Career Guidance Series UK for all medical students in partnership with AMBOSS. We are excited to introduce you to Dr. Lin Tuleimat, who will be delivering the fourth webinar under the Career Guidance Series for UK, titled Internal Medicine Talk. Dr. Lin Tuleimat, an MBBS graduate from Alfaisal University, holds a master's degree with distinction in clinical neurology from the University of Sheffield, United Kingdom. Aspiring academic neurologist and currently an internal medicine trainee resident at King's College Hospital in London, UK. Continuing experience in research, teaching, and quality improvement. Thank you for joining us today, Dr. Lin. We are looking forward to this exciting webinar.
Thank you so much for the introduction, and thank you for all your efforts. We're gonna talk today mainly about internal medicine, but because in the previous talk there were some questions about other specialties, I'm gonna have a general guideline for any of you who want to know furthermore about other specialties and how to apply to them. So good afternoon. My name is Lynn, and we can start now. I'm just going to share my presentation. Okay, so we'll start off with the application process to the internal medicine specialty. And the most important thing is to know what are the points or the aspects where you can actually get maximum points and therefore maximize your chances and become a competitive applicant. So we're gonna start off with these aspects or domains where you can achieve maximum points to basically maximize your chances. So this link actually has all the information that you need to know, which we're going to open and see together now, but it has all the information that you need to know about the application itself, what you need to prepare, and so on and so forth. So we're going to go with the applying and go through the application form and the application scoring. So these are the things that you guys can actually work on now to try to get the maximum points in each of these sections. So as you can see, the sections are additional undergraduate degree or postgraduate degree, additional achievements in terms of prizes and distinctions, presentations, whether it was oral presentations or poster presentations, publications, which usually should be PubMed indexed, teaching experience, or teaching courses that you might have attended, quality improvement projects, and leadership roles. So let's go on them one by one to see what you can do in each of them to get the maximum point. There are sometimes changing the scoring system, but it's not, for the past like 5 years, there hasn't been any major changes, but always before applying, check if there has been any changes, but usually it will be a difference of 2 to 3 points on things that they have assigned a score for. So we start off with the undergraduate section. Basically, some of you have done a psychology degree or have done another degree and then come into medicine. This actually counts because as you can see here, if you had this during your medicine pathway or before starting medicine, you get actually 6 points. But it has to be either a first honors or second honors degree, and that can be provided as a letter from the university. And then you can also get points if it was an intercalation. Usually that happens in UK when they do the medicine, they can get an intercalated master's or another bachelor's degree. But otherwise, I think what applies to you here, if someone started prior and then entered medicine, if it's a first class or second, first honor or second honor, you can get up to 6 points. If it's less than that, you can still get points, which is basically 3 points. So that's something that can give you additional points when you're applying. Next would be the postgraduate degrees. Basically, if it's a PhD or an MPhil or a DPhil, this actually can give you additional 6 points. There's also the options of, obviously, because this is the highest postgraduate degree, so it will have the maximum score. But if you do an MD, which is basically in UK a 2-year original research-based degree, or an MPhil, which is a master in philosophy, and these can be medical field related or non-medical field related. But if you have either of them, you get 5 points. If you do a master's degree, and also that can include something that's not medical, you can also get 4 points. So there are some universities, when you do the bachelor's in medicine, I think they have to have a dissertation. So that actually counts. It gives you 3 points. Otherwise, if you have any other postgrad certificate or diploma, that can also count towards your application. Basically, the postgraduate diploma or postgraduate certificate, for those of you who are not aware, the difference is it's just the progression of when you're doing a postgrad degree. So let's take an example of master's. If you actually do the entire number of credit hours set for you, then you take a master's degree. But if you decide to leave on earlier, so basically you decide to leave on before starting a dissertation, you actually still get a degree, which is called a postgraduate diploma. If you just do, I think the number of hours was around 90 or 100 credit hours. If you do just that, then you get a postgraduate certificate. So there are some people who actually don't continue with that for one reason or another, but they do still get a certificate. So that's what this applies to. If someone is already doing a postgrad degree, it can be a diploma or a certificate or a master's, depending on the number of credit hours that you're actually doing. So this is for this section of postgraduate degrees. And I know some of you have showed interest in pursuing a master's degree. So that can actually add to you, not only in internal medicine, but generally in most of the other specialties applications. The other domain now is the additional achievements, which is basically honors or distinction during medical school. So you can see that if you had honors or distinction, you get 6 points, and it has to be within the top 18%, which can be provided as a letter from the university that can provide all this information, basically. If there was an award of an international or national prize related to medicine per se, this can be to medical undergrads or postgrads, and that can give you 4 points. If you have one or more prizes or distinctions related also to the medical course that you're doing, and that's not given, that's only given to the top 20%, that can also give you 2 points when you apply. So basically, they will just look at your medical degree, what kind of GPA do you have, first honors, second honors, and they would like a letter provided to show. But as long as you have that kind of evidence, that can give you also additional points. And then we go to the presentation section. So basically that includes the oral and the poster presentations. And as you can see, the maximum score is given for oral presentations. And usually if you are a first or a second author that's presenting this, and it should be within a national or international conference or meeting, you get 8 points. The same criteria applies to a poster presentation. If you do that as a poster, you get 5 points. Otherwise, if you are doing something more regional rather than national or international, you still get points if it's oral. So as you can see, if it's an oral presentation and you're the first or the second honor, but it's a regional meeting, you also get 5 points. And then the less points will be given if it's oral or poster, but it's given in a medical meeting, a local medical meeting to the university, for example, or to the college itself. So that gives you also points, but it will be 2 points. And then we move into the publications section. Also, that gives you a lot of points. So if you are the first author or the joint first author or corresponding author, it's important to mention that only the PubMed index will give you high marks. If this is something that's published in a non-PubMed index, it might not give you so many marks. So if you can see, if you're the first author, joint first author or corresponding author, if you have 2 publications, at least like that or more, then you get 8 points. If you are a co-author of, again, 2 or more, then you get actually 7 points as well. If it's just one publication, but you are the first author in it, you also get a high mark in that, which is 6 points. And then from there, if you are doing a book publication, that gives you 6 marks. If you are doing a publication, which is, again, if you can see, most of the marks are on PubMed cited publications. Again, if you have 1, then it will be 4 marks. As we said, it will be double if you have 2 or more as a joint first author or a first author. And again, the same applies if you have a book related to medicine that you're publishing. It depends on how much contribution, but you also get marks, as we said. You do get points for something that's not PubMed cited, but it's less marks, as you can see. So if you have 1 or more abstracts, non-peer-reviewed articles, or published articles that are not PubMed cited, even if it's 1, you do get 2 points. But the higher marks goes for publications that are PubMed cited. That's for the publication perspective. We move to the teaching experience. So the teaching section of this application scoring has 2 parts. You either have teaching experience or training in teaching. So we're going to go through these as well. So for example, the highest mark, an example of that we are doing in our university currently is pre-med, neopod, all these programs. If you actually contribute to them or participate significantly in organizing them, you actually get a high score. So if you have worked, as it says here, if you worked with local tutors, you designed and organized the teaching program for medical students, and you contributed regularly to that program, and you actually did some teaching in that, and you have some feedback, you actually get 6 points. If you have organized this over a period of 3 months or longer, and had 1 or more sessions that you contributed to them, you get a bit of less marks. So they want to see either a continuous contribution to the program, or least 1 or 2 sessions that, in addition to your organization in the program, you have given also 1 or 2 sessions. Now, this can be provided as an evidence if you ask after you work in such roles. If you ask the university to just provide a letter of recognition that details what you have done, what were your roles in the, or what were your jobs in the role that you were taking, that would be enough of an evidence to support that you have already done that. So it doesn't have to be the teaching observation form. You can definitely collect that, but if it proves to be a bit difficult, if you have finished that a while ago, then you can just get a letter of recognition from the university and it should be accepted. Otherwise, if you have provided regular teaching for medical students over 3 months or more, for example, I think PAL should count for this one. It's over a course of a year, and if you provide regular teaching sessions in that, then you can actually get points. Same applies. So whenever you do something that has teaching, try to get a letter of recognition that just details what you have done, basically, and how long have you done it for. The least score will be given if you've just there's evidence providing that you have taught medical students occasionally, you have some feedback that gives you some marks. The maximum marks would be contributing to organization, a long term of 3 months at least contribution to the teaching program itself. Now, the training and teaching can be in various forms. Some people actually go for masters in teaching qualification, and that gives them 4 extra scores. If they have a PG certificate, as I explained to you, or a diploma, they also get 3 marks. However, if it's something that's not a teaching qualification that takes you 1 year to take, but something that is like on a day's basis, for example, if you can see the least one would be have brief training in teaching methods. That's 1 or 2 days, and you can see a lot of these courses that you can attend online or you can attend in person. That gives you 1 mark. If it's something more than 2 days, which is like a module that you have done, which is a part of a postgraduate teaching qualification, that gives you 2 marks. So the least would be if you have attended a course in 2 days' time. In between would be something that you have done as part of a master's that can give you mark even if you haven't finished your master's, for example. And higher than that would be the teaching qualification, which would be a medical education master's degree or a postgraduate diploma. And then we move to the quality improvement section. By the way, I'm going to go through all these sections of the application scoring, and then I will start taking questions on that, because after that, I'll let you know how to proceed with the interview. The quality improvement section, for those of you who have worked in a quality improvement project, basically, quality improvement project is something that happens very frequently in UK, and this is done in different departments as well as others to just try to meet up with the standards of care nationally. And this actually contributes significantly also to your scoring. So the idea of the quality improvement projects is to study an aspect of the service in the department and see if there has been anything that you can work on or improve on, do an audit or a data collection to prove your point. And then from that point forward, you can actually, after analyzing these data, know exactly what is missing and what you can do to improve on it, and then provide a way or a method to improve this quality, whether it was a documentation, a checklist, whatever it may be applicable to the project that you're working on. That finishes off actually a cycle at least. If then after you've made the change, you've applied this change, that starts another cycle. So once you apply that change, you also do another analysis or another data collection to make sure that the change that you have suggested or recommended and it's now being applied is actually working well and changing the data. on this specific aspect of the service, that completes another cycle of the quality improvement projects. So this is the idea of a quality improvement project. I think this is something that can also be done on the university level or when you're doing clerkship. If you have an idea in mind or you discuss it with your mentors, it's something that you could do even before you come here. So this is just an idea of what a quality improvement project is. So basically the highest mark would be if that you are involved in all the stages of the cycles, but they should be at least 3 cycles to get the maximum points. However, if you did 2 cycles, then you get 6 points. And if you were involved in some stages, which means that you didn't contribute to many things in the project, but you did have some contribution to it in 2 cycles, then you get 4. Because sometimes it's with these projects, you might be working on it on your own with the supervisor. Sometimes it can be you and 1 or 2 other people. So it depends on how much contribution you're actually having. If you contributed to all the steps, then you get a higher marks. If you're contributing to less steps, then you get slightly lower mark. If it's just a single cycle, you still get 2 points for that as well. And then the last section is the leadership role section. So if you've actually held a national or regional leadership role that has management aspect to it for at least 6 months, and you had a good feedback, then that gives you 6 points. So they give you examples of a trainee representative of a special society, nationally held leadership and management fellowship, charity, guides, sports. It doesn't have to be in medicine, but if you've held something like that, that gives you points. Also holding a local leadership role in 6 months can also give you 3 points. So example of that would be if you're working in the different committees in the MSA. So if you're working in the growth and development and all the other committees that have any, it doesn't have to be that you are actually managing the entire committee, but if you have a leading role within that committee, then you actually get points. As long as they see that you have had a managing role within a committee, you get 3 points for that. So this just gives you an idea of what things you need to work on to maximize your chances prior to applying. So if you're aware that these things can give you a lot of points, including presentations and publications, try to get some presentations before you come here, some publications, and I know some of you who are already working on that, but all these things, if you can actually manage to get some of them, and a lot of them can be managed prior to actually coming here, you get maximum points, you maximize your chances. This is the first step of an application to the internal medicine. There is still other things that will score you and will determine where you will be, and we will discuss that as well. But before I continue, if you have any questions about the application scoring itself, which is the first step to applying to internal medicine, let me know. It's just important to mention that these, again, almost apply to all other specialties. So it's not just internal medicine. This actually opens the door for many of the other specialties. I'll just tell you mainly what is the difference towards the end, but there are a few differences between this and other specialties, but these are all shared in common in almost all the specialties. Okay, so will I get points if I was second honors? As far as I am aware of, you do get points, but it's not going to be as high. Let me check. It might be. I think what they want to see is, were you from the top 18% or 20%? So if you were within that and you have a letter that provides that, then it can be counted. That was my understanding from this, because second honors should count, but it's just, I think they need to see that it's within the 18 to 20% range. Can you repeat what is training and teaching again, please? What can I do to achieve it? So basically training in teaching, it ranges from something that you can do of a 1 to 2 day course, or you can actually have a postgraduate certificate for that. So the 1 to 2 day course, I can recommend some of them for you, but for example, a known one here is called Teach the Teacher or Train the Trainer. So basically this is a 1 to 2 day course. You can do it online and you can do it face-to-face. And basically that gives you more information about the methods of teaching, how to conduct different ones, what would be better for doctors, and so on and so forth. So this gives you a point. However, if you do something that's a postgraduate certificate or a postgraduate diploma, which is, as I told you, depends on the credit hours that you do within that postgrad degree, you also get points. The highest points would be 4 points, and that is if you achieved a master's in medical education, which also is available here. You can do it as a 1-year course, and that actually provides you 4 points in addition to any other, as I told you, medical programs that you have actually been part of and you have organized and you have contributed to regularly. That also gives you 6 to 7 marks. I hope that was clear. For leadership, if I was my group's leader, I'm in clerkship years. Does that count? It should potentially do, but you need to, when you say group, is it the small group or the larger group? The small group, it can count, but you need some form of evidence that provides what were your roles if you were the group leader, and what did you contribute to in terms of leadership and management. So I think the most important aspect is providing evidence, because this is for an entire year. So it could potentially count, but they want to see an evidence of what actually did you contribute, what were your roles. So that's why I told you it's very important when you actually do anything, get a letter of recognition from the university that details what you have actually done, what was your role, but it should potentially count. Will I get the highest teaching points if I were a BLS instructor? Yes, because as far as I'm aware of a BLS instructor, they're organizing, they're doing it over a period of time for many, many sessions. So I think it should count. And that actually counts in many other specialties as well. If you're an instructor, it gives you a lot of points. So yeah, it definitely does. Do you guys have any other questions in terms of the application perspective? All right, thank you. Thank you so much. And if you guys have any other questions, we can come back to that later. It's basically, you need to know the entire system. This is just the start point. This is what gets you actually shortlisted. So basically all these points, when you apply, the website is Oriel. So just so that you have a bit of an idea. So basically this is the website. And from that, you actually apply and you see what are the vacancies, and they ask you some questions there that basically is about all of these points. The application form will just ask you to put a bit of detail about all these things. They will ask you, why do you want to apply to medicine? Can you provide some form of evidence that you have a commitment to the specialty, and so on and so forth. So the application through the Oriel website would be mainly about just answering this, providing more detail, and then you upload any kind of evidence, which will also should be presented when you do the interview. So this is what's expected at this level when you apply. Basically, just so you have a bit of an idea that dates don't really change. When does the round open for recruitment and when does it close? So basically, they usually open by either the end of October, beginning of November, and they close by the beginning of December. So it stays open for a period of 4 weeks to 6 weeks. And then, as you can see, there's long listing and short listing. This basically, the long listing is largely dependent on the CREST form that we have discussed earlier. So they actually check that the CREST form meets the criteria. There isn't anything that they need correction or they need more elaboration on. Once that's done and that's accepted, you are long listed. The short listing is then according to the score that you have. So basically, that becomes more competitive if more people are applying. So if you ensure that you have at least, I would say, 20 points and above, you will be shortlisted. But I think the minimum they mentioned was 11, but I'm saying 20 and above, just to be on the safe side and make sure that your chances of actually getting shortlisted is high. And that is easily achievable if you have contributed to any of these sections that I've discussed with you, and importantly, provide details, because that's what that's what will, you know, allow this to be scored in the interview as well. Because if you tell them that I did 1, 2, 3, 4, 5, but you don't actually have any form of evidence for that, you would not have any scoring for that during the interview. So please make sure whatever you do, have some form of evidence for that right away. So the shortlisting will be dependent on the basically the score that you had for the application, which is what we just discussed. Long listing is just purely about the CREST form and the fact they accepted it. And then you get invited to the interview, and the interviews are usually held between mid-Jan to mid-March. And from that point forward, after the interviews, you get ranks and you put the program preferences, which I will discuss. But let's first go through the interview process. So up until here, you are aware of what you need to do. In the interview itself, first of all, if you guys attended my previous lecture, I did mention that there is a book that you can actually use. This book, it's very good to prepare from this book, because it actually provides a very good and thorough, you know, elaboration on how the interviews are conducted, what questions might come, what things you need to concentrate on, whether it was from the ethical scenario point of view or clinical scenario point of view or portfolio. So it helps you prepare well for the interviews. So make sure you have a read through on this before you attend the interviews. Basically, some of the interviews now, because of the COVID situation, have been mostly online. This might change back again to face-to-face, but a lot of them has been conducted online. And there was 1 year where there was no interviews to begin with. But now I think a lot of them are being conducted online. They send you an invitation link and you proceed forward from that. And basically, the most important aspect is to make sure that in that case, if it's still online, to make sure that you have put all your references and all the letters of recognition and evidence on the website so they can have access to it. They will let you know whether you need to upload it somewhere else, because this is changing now in the past few years, but basically they will let you know whether you need to upload it at a specific website or it should be on the ORIAL. And basically that can give them access. And when you need to be discussing these aspects of the application, they will actually be able to see what you have provided. So basically, the structure of the interview would be these 4 stations. The first one would be a clinical scenario and a patient handover. So basically, they will give you a clinical scenario. You'll be asked questions related to the scenario. So they would ask you, what would you do in terms of investigations, for example? What differential diagnosis do you have? How would you immediately treat this patient, treat them long-term, any information you would like further from the patient, and how would you go on in communicating with other members of the multidisciplinary teams or family members or the patients themselves. So basically in that section, they will give you an mark based on the investigations and the diagnosis and the subsequent management. And the second mark will be solely for how you're handing over and how you're relaying the information, because that's something that happens every single day when you're working as an internal medicine specialist. You need to be able to clearly hand over the patients from your shift in a clear manner, not going into details that might not really be important, and not missing things that might be vital for the next team to follow up. So that's something they really concentrate on, to make sure that this briefing of cases that you've seen is something that you're training on, because that's important in the interview and after. So that would be the first station. The second station would be an ethical one, and basically they will deal with moral or legal issues that can happen during your hospital work. And basically the first one, they would give you the question or the case in advance, but this one, it's not going to be given in advance, and this will be given to you right before you enter the station. And basically they will assess you on how you deal with this. How do you respond? Are you considering all the aspects, the ethical aspects, when you deal with such a case, and so on and so forth. This will last up to 5 minutes. And then you have the suitability and commitment to specialty. And here it's mainly a discussion of a portfolio. So basically, it will focus on what you have done so far, what are your future ambitions, what subspecialty you're planning to go for. And basically, they just want to see that you are working on yourself, whether it was academically or clinically, and you are committed to the specialty that you're going into. So obviously you have provided this in your application. They want to discuss it further with you. So that's when you present yourself, present your strength points, what you have done, what are you planning to do as a subspecialty? Have you actually, explored that? If you show them that you already have this in mind and you're exploring these options and you're doing things to maximize, that's what they want to see. They will give you a high score in this section or this station if you actually provide details and give them, the relevant evidence. And that will not be more than 3 minutes. So, and the last thing would be the application and training. After they, finish answering you about your portfolio and what you have done so far, it will focus on what you have mentioned in your application form. What kind of clinical experience do you have up until now? So basically, they're going to go through everything that you have mentioned in your application form and try to ask you bits and pieces here and there, just to have general idea about what you want to do, what you have done so far, and so on and so forth. So the difference between this one and that one, the other one is specifically, are you committed to this specialty? Have you done things to show the commitment to the specialty? It can be through different ways, whether it was courses, ALS, being an ALS instructor as well. If you are planning to go into a subspecialty and you're showing, for example, you want to do cardiology, you have done a lot of courses in cardiology, you have attended conferences in cardiology, you've done a lot of teaching in cardiology. That's what shows them commitment, that you're already working on the subspecialty and you're starting off from now at an early stage of training. This will be more general. The last question will be more general about you, what you have done so far, what you're planning to do. And this will also last up to 3 minutes. So the first 2 stations will be a bit longer. The last 2 stations would take usually 2 to 3 minutes. Just be concise about what you want to do and show your strength points always. So basically, this is the structure for the interview. And obviously, this interview has its own scoring besides the application scoring that we talked about. And usually, these together will determine, where you will be and which preference you will be able to get. Just important to mention that basically, what's nice here is that even in exams here, by the way, if someone has any dyslexia or disability, if you just inform them, they'll make sure that they'll adapt the assessment or the interview so that it can fit. So this is something also important to mention for people who has been diagnosed with dyslexia, for example. They actually give you more time. And basically, after that, what are they going to score you on? So basically, first of all, they have a scale to score you on, 1 being poor and 5 being excellent. And basically, 5 would be at the level expected of an IMT person, not only an FY2, but an IMT person or even above. 4 would be the expectation of the level of an F2. Basically, anything that's 3 and above would mean that you are suitable for appointment. So basically, there is a raw interview score, which is a sum of all 12 scores during the interview. And each of these will be from 1 to 5, as we just mentioned. So the raw score will be from 12 to 60 points. And then to be classed as appointable, you have to meet all the criteria listed here, which is none of your 12 interview scores is 1 out of 5. And no more than 2 of your 8 interview scores are 2 to 5. So that if you have them all 3 and above, you have maximal chances. But if there is more than 1 that is 1 or 2 out of 5, it might affect. And your raw score should be 36 or above. So obviously, it's important to know all of these things just to know how to prepare well in advance. If you meet all these requirements, you'll be appointable. But appointable and getting into the preference that you want is something that we're going to discuss now. The total score, generally, just for you to be aware of, as we said, everything is out of 5. So you'll have 2 panel members that will assess you. And basically, on the question 1, each of these sections, so the clinical scenario and then the patient handover, each of these will have scoring. And then each of the other stations will have a scoring out of 5. And there would be a mark generally for communication and how you are conducting your communication. And then based on that, they calculate it out of 60. And then they have a different weighing of different questions. So as you can see, a lot of weighing would be on question 2, 3, and 4. Here they have the first question, they've divided it, and most of it will be on the investigations, the diagnosis, and the management. A bit of it will be on the patient handover. So as you can see, they weigh them, and according to that, the raw interview score is something different than what the final score will be, according to what's the way of each of these sections of the stations. And the maximum scores, as you can see, for each of those is written right here. So the overall would be 80. So obviously, the more scores you have, the more likely that not only will you be appointable, but you will be a competitive candidate and you'll get the choices that you have, put in, which we're going to discuss now. So basically, if you want to also see, for example, how were the previous years, how many people got above a certain score, basically, they do consider also the application scoring. So with all this, if you have a higher mark, that will give you a higher rank. A higher rank will guarantee that you get into the preferred hospital that you have, you're going to apply for. So if you want to also have more idea, as I told you, just go here. It's in the document library. You just see how the previous years have done, what was the most of the scores that range between, and how many people did get in. Basically, all this happens before you actually say, I want to be in this hospital or that hospital. So the difference between this and other systems is the other systems, you're going to each of these hospitals that you have applied for individually. In UK, it's a national standardized system. So here, this is something will be on a national basis. And after you get the interview and after you get the scoring, you get the rank. So basically, I don't know if it's present here, but generally speaking, the ranking is based on your application scoring and interview scoring, as we discussed. So if these two are high, it's just the ranking will be according to all the other applicants that have applied this year. Where do you rank between them, depending on your score? That is the rank. And basically, there might be, like, for example, 3,000 that applies in a year, but only 1,500 got to the interview part. So you already, I think they provide you this information later, so you're aware of, you know, how many people applied, how many people got in for interview, and then where do you rank above this number. So that's the ranking. Now that we're discussing the ranking, from that point forward, you actually get into Oriel. They will publish your ranking, and then they will ask you to put which hospitals do you plan to apply for. So basically, there will be many different tracks for many different cities in the UK. And as I told you before, I think it's important to also think, if you're applying for in medicine, it wouldn't be very different, but if it's in other specialties, do put that in mind, that you want to go to a city where it's known to have a national center for this specialty. Otherwise, the choice will be based on a lot of things here. So you have different cities, and in these different cities, you will have different hospitals to work in and different specialties to work in. So they actually give you all this information. So an example, you will get, for example, London. London has northeast, northwest, and so on and so forth. So it has different regions. Let's say that you've chosen South London. South London will, for example, have King's College Hospital and St. George's Hospital or St. Thomas's Hospital. They will tell you, for example, that the first year will be in King's College Hospital, and you will get an ICU, cardiology, and gastroenterology. The second year will be in St. Thomas's, and you will get neurology, care of the elderly medicine, and any third specialty. Basically, you need to be aware of, they always put ICU and geriatrics because you need to finish these in 2 years. So these will always be there. What's important, the reason I'm telling you this will apply to many different cities and many different regions of cities. So they will actually give you a track that it will go like this. You choose whatever is more convenient for you in terms of location and in terms of specialty. So if you want to do a cardiology, it would be good that if you have cardiology rotation in your training. Same goes for any other specialty. So sometimes the choice should not also just be dependent fully on the location, but actually what rotations are you having, because you would want to have the rotation for the specialty you want to apply for later on. This doesn't minimize your chances in getting into the specialty later on, but this is something that you should think about when you're putting your preferences. So you'll have a lot of these tracks. You put whatever you prefer to go for, and there will be like 1,000 at least of tracks. So this requires some time. You need to sit and see all the available options that you have, which is best for you, and you put it there. After that, there is an algorithm that's computational and anonymized, and that basically matches people according to the rank and according to their scores. Based on that, you will get the highest rank that you have put that is applicable, that has not been taken by an applicant that ranked higher than you. Having said that, if you get an offer based on that, so that happens usually between March and April. If you do get an offer in a place, that doesn't necessarily mean this is final. The reason being is you get an upgrade. There's a choice that you can tick that I will consider upgrade. And the reason being is people usually don't just apply to internal medicine. So you'll find them that they're applying to internal medicine, GP, surgery, for example. And then if they have offers for, all of them or one or two of them, they will make a choice. So even if, for example, that person ranked higher than you, if they end up not accepting that offer from internal medicine, you get bumped up. So the upgrade is basically for that, because they're aware that people might be choosing different specialties and they might not accept that offer. So that offer comes to the next person in line, and you can easily be the next person in line. Basically, there is like 2 or 3 rounds of upgrades, and you can get the upgrade at any point. So the reason I'm saying this, sometimes people don't necessarily get into the city they wanted. But if you get an offer at the beginning, that doesn't necessarily mean it's final. You just wait, because a lot of people I know did get upgraded. Most of the people got upgraded. So if you get it from the first time, perfect. Don't take that option if you're happy with the place that you have gotten. If you still feel like you might have a chance to get into somewhere that you have wanted better or wanted more, then you just take that option and wait for an upgrade, basically. This entire process, as you can see, lasts until the end of April. By the end of April, you'll be aware where you'll be for you to be starting by beginning of August. So the year starts from August, and then you get the 2 to 3 years of internal medicine, basically depending on which specialty you're going for, which we're going to discuss next. This is up now to the interviews and offers part. As you can see, it's just working on your CV to get in. After the interview, just know how the interviews are conducted, prepare yourself very well, provide all the evidence that you can have, and the chances of getting into a hospital you want is not very difficult. It's just, honestly speaking, if you maximize your chances in the application scoring and the interview scoring, which is not really difficult, as long as you're aware of all of these things in advance to prepare for them, you'll easily get a high rank, and you'll easily, get therefore the hospital or the area that you wanted to go for. One thing important to mention is that the ranking on its own, if you, for example, have a ranking, you need to understand that it's thousands of people applying. And most of the time, there is like 2,000 people waiting for seats. So for example, if your ranking, let's say, is within the first 500 or 600 or even the first 1,000, that doesn't necessarily mean that you won't get into the place that you have wanted. As long as, what I'm trying to say is, obviously, if your rank is higher, the chances of you getting into the place you want is much higher. But if you are within the 1,000 or even after that, you still can actually get the hospital that you have wanted. A lot of that happens with, chances and luck, because as I told you, you can be bumped up very easily to get what you wanted. So it's just a matter of who is applying. Are they applying for more than one specialty? Did they take the other specialty or not? But ranking is just important in terms of just getting it from the first time. But otherwise, a lot of people actually might not get the place they wanted the first time, but they will get it later. But anything within the first 1,000 or 1,500 maximizes your chances of getting into where you wanted. Being within the 2,000 range, you can actually get a seat no matter where it is. Most of the people will get a seat. It's highly unlikely that people who have passed the interview panel would not get a seat. But it's just a matter of what makes you competitive, what maximizes your chances of getting into the hospital that you want, basically. So that is in terms of getting into internal medicine training. Before I proceed forward with the next section, which is about what is expected from you as an internal medicine trainee and what specialties you can apply for from thereafter, because it's good to have a bit of an idea about that prior to starting, so you know when to apply, basically. If you have any questions about the interview process or the application process in general up to here, please feel free to ask me now. Shall we proceed forward to the next section? I'm going to give you guys 1 more minute just in case you have any questions about this, because there was a lot of information. Okay, so we will proceed forward for internal medicine training and what to expect when you start the training. This will not be very long. After that, I will actually discuss, the other specialties. I believe my colleague Abdullah discussed ophthalmology and neurosurgery. So I will discuss the other specialties that you might be interested in and how to get into them. So basically, the next section will be what requirements do you have when you start the training? So basically, I think this is really important for you to also be aware of when you enter training so that you're not overwhelmed. So basically, as an internal medicine trainee, you will have a review panel each year, and that will be in June. And basically, they have certain expectations from you so that you can pass each of these years. We're going to go through what exactly are they looking for in each year, so that when you start, you're aware of these and you start preparing for them in advance. Because if you leave them until the last minute, it might be very overwhelming. So first of all, when you start your training, you will have what we call an educational supervisor and a clinical supervisor. An educational supervisor is basically the supervisor who will be, you will be under their supervision for the timing of the internal medicine training. So it's usually 2 to 3 years. No matter which hospital you move to, he will be your supervisor or she will be your supervisor for the next 2 to 3 years. And basically, these are the ones that provide a report for you towards the end of each year to make sure that you're progressing well. And obviously, that will be with discussion with you. The clinical supervisor, on the other hand, is someone who has worked with you in each of these rotations. So the educational supervisor is someone that stays throughout the training time. However, the clinical supervisor is a person who just works with you in one rotation, gives feedback to the educational supervisor, and that changes with every rotation. So as you can see, an educational supervisor report is very important because that basically will sum up everything that you have done so far, and the educational supervisor will be able to rate you and make sure to state that you are at a satisfactory level and can be moved to the next stage. So what does he look at? They look at what we call SIPs, or generic capabilities in practice, and clinical capabilities in practice. And we're going to go through these now. But basically, it's just in regards to how you're integrating well into the system. You're able to basically function well, know the ethical dilemmas that you might, be presented with, doing teaching and research. And then the clinical ones would be, dealing with acute deteriorating patients, managing outpatients, and so on and so forth. Basically, these are things that you will be rated on by giving assessment, by asking for assessment from different registrars, specialists, or consultants that you work with. And there are different ways to assess you using these. So we will discuss what these include, which is here. Basically, these are the clinical ones. So managing an acute unselected take, which basically means that you need to be able, the acute unselected take is when you are working in general internal medicine or acute medicine, and you are the medic present in A&E to clerk the referrals that come in. So obviously, when any patient comes to A&E, they might need to go to different specialties. So you're the one who would be accepting the patients going into the under medicine, and you need to be able to clerk them, make a proper diagnosis and management plan under supervision. So as you can see, 2 is under direct supervision. So that is what will be expected of you at the first year, but you should be progressing towards indirect supervision by years 2 and 3. So that's for the unselected take. And usually you have to have seen 100 patients in a span of a year. So you always keep a logbook of the patients that you have seen, what different cases have you seen, so that you know that you have seen that number at least. Managing an acute specialty related take would be the same point, but it's in a specialty. So like, for example, in cardiology or neurology, when you do these rotations. And then providing continuity of care to medical inpatients. Basically, these are different assessments that you can do that just shows that you're working on the wards, you're functioning well on the wards, and also managing the outpatients that have other long-term conditions. And then managing medical problems with other specialties. So you're able to communicate with different specialties and manage the problems accordingly. And you are a good member of an MDT or multidisciplinary team and is able to do a safe discharge, and then delivering effective resuscitation, managing deteriorating patients, which can be on the wards or in accident and emergency department, and then managing end of life and applying palliative care skills. Some of you might have a palliative care rotation, some of you might not, but you will get a chance to do a 1 or 2 days in palliative care department to see how things are going and help them in managing the patients, and you can get your sign-offs from there. So basically that's what they're looking at when you're doing your training. And you need to be able to supply different evidence for that. So which is basically, let's start off from here. You get a multiple consultant report. So you need to get 4 multiple consultant reports. And these are basically a form, an assessment form that you need to send to different consultants that you have worked with. And they will rate you on actually these points that I have just discussed. So you can do it on the wards or when you're in the accident and emergency. But when you're in year 2, they are expecting this most of these to come from the consultants that you have worked with while you were doing the take, which is in A&E. Multi-source feedback, or MSF, basically this is something that you just send as an assessment form to your colleagues so that they can rate you. And it should be at least 12 raters. 3 of them should be consultants. This can be medical or non-medical staff, and you need to get 1 a year. And then you have supervised learning events. Basically, these can include different ways of assessment. One of them is acute care assessment tool, or what we call ACAT, and you should get 4 each year. And basically, this just shows that you have seen 5 patients. They have been discussed with the consultant, and the consultant has given you feedback on that. Basically, that's what ACAT is. You list the cases, which should be at least 5 cases minimum, usually in an acute setting. And then basically the assessment of the consultant would be on there. And then there is what we call case-based discussion, or mini CEX, which is clinical evaluation exercises. And this is all should be at least 4 in number as well. Basically, this can be when you discuss a case with a consultant, you can send him or her an assessment form that they can rate you on. A mini CAX is basically when you're doing an admission and you're clerking the patient. You can actually discuss that patient with the consultant, and then you get that signed off as well. If you're doing anything basically hands-on, this can be signed off. Case-based discussion is just the discussion with the consultant about different cases. And then the board exams that I discussed earlier, which is the MRCP, you need to have passed at least part 1 in the first year, but then they expect you by the end of year 2 to have finished all these exams. Having said that, it doesn't mean that you will not progress further if you have not finished all these exams by year 2, but you might be given a different outcome, which is you might need a prolonged training until you finish them, or they might give you an additional time, specific additional time to finish all these. It will be discussed with you on what your plans are and when can you finish these exams. But if you don't finish them by year 2, it wouldn't be the end of the world. It's just that this will require a discussion with the panel of what are your plans to proceed forward. And then general pieces, bits and pieces here and there is the having a valid ALS each year, having been working on a quality improvement project, or at least have participated, that's in year 1, participated in the activity, like having a plan at least for the quality improvement, even if you haven't started working on it yet, should be okay. Otherwise, they're expecting you to have had an involvement throughout the years with different quality improvement projects. And there's something called QIP-AT, which is basically a quality improvement project assessment tool. And you send this after you finish at least a cycle to your consultant or supervisor who supervised the project, and they can sign it up for you. And then for the outpatients, you have to see at least or do at least 20 outpatient clinics per year. And they expect you to have a maximum of or a minimum, of 80 clinics that you have done throughout the last 3 years. The unselected take, which is the, as I told you, the medic in A&E, you need to have seen at least 100 patients. And they expect you by the end of the 3rd year to have seen 500 patients in total. And lastly, you need to have a critical care rotation, geriatric rotation, and you need to have a simulation of the different procedures that are expected from you, which I'm going to discuss now. They usually do a simulation course, and that should be enough the first year, but a lot of them, you need to have done them, hands-on, if not the first year, by the 2nd year. And lastly, they expect you to also attend teaching, at least 50 hours of CPD, and usually they should be 20 hours can be local or internal teaching projects, but the rest should be from external courses or external teaching sessions. What are the practical procedures that are expected from you? Basically, CPR is included, and then temporary cardiac pacing using an external device, ascitic tap, lumbar puncture, nasogastric tube, pleural aspiration, and chest drain, and then access to circulation, which usually is central lines, femoral or interosseous, or central venous cannulation, and intercostal drain for pneumothorax, as I mentioned, and effusion, direct current cardioversion, which usually can happen in a clinic setting or in an emergency setting, and then abdominal paracentesis. And as you can see, some of them are actually expected from you to be able to do them without supervision by year 2, including the ascitic tap, lumbar puncture, nasogastric tube, pleural aspiration, and direct current cardioversion. So this is something for you to be aware of, to prepare in advance and know how to organize your time. The educational supervisor report would basically just rate you of whether you're able to do all of these things with direct supervision. And he will basically have seen all the evaluation forms that you have done and make the decision according to that with discussion of you. And then basically the panel will look at that report mainly to decide on what's your progression for next year. So basically, this is what's expected from you as an internal medicine trainee. If you have any questions on that, please feel free to ask now. Otherwise, the next section will be, I'm just going to quickly talk about the specialties that you can apply for and the other specialties outside medicine and how to apply for them generally. Any questions at all? I'm just going to give an additional minute and then we'll proceed forward with the next aspect. All right, the next aspect of this talk will be about after you finish your internal medicine, what are the different pathways that you can take when it comes to different specialties, because it depends on what specialty are you going after when you finish the internal medicine training, whether it will be, and that will decide whether it will be 2 years for you in internal medicine or 3 years. So you need to do 3 years of internal medicine training if you're going into one of these specialties here, including acute internal medicine, cardiology, pharmacology and therapeutics, endocrinology, gastroenterology, genitourinary medicine, geriatric medicine, infectious disease, neurology, palliative medicine, renal medicine, respiratory, rheumatology, tropical medicine. Basically, if otherwise the ones that has to do with infectious diseases and tropical medicine, if they are taken dual with training in medical microbiology or virology, you don't have to do 3 years. But otherwise, all these specialties are or need you to have had 3 years of internal medicine training to get into. So you start applying for these when you finish your 2nd year and you're going into your 3rd year, so that you start directly after the 3rd year. However, there are specialties which only requires from you 2 years from you, and they can usually last 4 years, up to 5 years, but usually 4 years. Here, it can go 4 to 5 years, depending on the specialty. So the ones that require only 2 years of training include allergy, audiovestibular medicine, aviation, clinical genetics, clinical neurophysiology, dermatology, hematology, and oncology, immunology, and nuclear medicine, pediatric cardiology, rehabilitation medicine, sports and exercise medicine, and tropical medicine. Basically, these will only require you to have 2 years. There is, just for you to be aware of here, medical oncology and clinical oncology, and that they are slightly different when you apply to them in terms of what is expected from you to do. So clinical oncology will involve you actively participating in chemotherapy and radiotherapy, and so on and so forth. Medical oncology will be slightly different from that aspect. Medical ophthalmology is another pathway which basically you can take to get into ophthalmology, but it will be different than the ophthalmology pathway, just because the expectation of what is your role as a medical ophthalmologist will be different. So medical ophthalmology does not involve any surgical aspect in the job. However, the ophthalmology pathway, the one that was talking about by my colleague Abdullah, would usually have all its subsurgical aspects. But if you go directly into medical ophthalmology, which is after 2 years, you don't necessarily get involved in that. So this is another alternative pathway to get into ophthalmology, is to do 2 years of internal medicine and then get into it. Obviously, it goes without saying that as you progress further in the internal medicine, try to prepare yourself for the subspecialty application, while you're doing your internal medicine, try to attend courses related to the specialty, try to publish at least case reports or do quality improvement projects in these departments, because if you do work on, and that's why I told you it's important, or it's actually valuable for you to have a rotation in your training that includes the specialty you're planning to go for, because that can give you time to actually work on different things related to that specialty and prepare your application then for the specialty training. Generally speaking, at that point, the specialty training, you just, they really concentrate on the things that I previously told you about, the same concept, postgraduate, quality improvement, teaching, and so on, but they want to see a commitment to specialty. So you need to have done things that show that you have been working to get into the specialty. So that's what would be important, and that's something that you can start working on from now, continue to work on as you do the internal medicine training to get into the specialty. Having said that, honestly speaking, getting into any specialty of your desire would not be very difficult. It's just knowing what is expected, what would maximize your chances into getting the specialty, what you need to do, what things can be done now, what things can be done while you're in training. It's just, if you are aware of all these, bits and pieces and the steps, you will be able to get into the specialty, even if it's very competitive. What I honestly realize, it's just about how you prepare your application and how you present yourself and how you continue to work on the specialty that you want and show that you're committed to the specialty. If you do that, you will be a competitive applicant, and inshallah, you'll get into the specialty you want. Nothing is really ever impossible. It's just working and knowing what you're working on to get into the training and maximizes your chances and become a competitive applicant. And that's not difficult, given that they give you all these person specifications and give you what you need to have worked on, what are the desirable specifications and the essential specifications. If you know these, you will be good to go. You will be able to get into specialty you want. So this basically sums up internal medicine, how to apply for internal medicine, how to become a competitive applicant, what is expected from you as an internal medicine trainee, what is beyond that, and how do you, utilize your training accordingly, and when do you start applying for the specialties after. So that would conclude the internal medicine talk. I will discuss now briefly about the other specialties that some of you were interested in. But if anyone has any questions about internal medicine from the application up to here, please feel free to ask me. Okay, so just so I'm aware, last time people were mentioning radiology, ophthalmology, neurosurgery. I will be talking about radiology. I think my colleague talked about ophthalmology and neurosurgery, so I'll be talking about radiology, pediatrics, and OB/GYN. If you have questions about other specialties, do let me know, and I will give you general guidance of what is expected and what websites can you visit. So if you can just pop in the chat if you have specialties other than the ones that I just said that you would want me to discuss, let me know. Okay, pathology, I'll try to cover that. Okay, if there are any other specialties that you guys want me to discuss further, just please pop them in the chat. I will try to cover pathology. I'll show you the person specification for that, so you're aware what exactly are they looking for when you apply. Yes, definitely. So what I will be doing is that I'll send the presentation so that they can forward it to all of you. That should include all the links that you need to be aware of. I know there was a lot of information that I said now, and there might be some questions later after you have a proper read through on them. hopefully you'll be able to receive them by next week, the presentation, and it should have all these links in them. And please feel free to contact me if you have any further questions about them as well. I'll be more than happy to guide you, because I know it's a lot of information to take in, a lot of things to consider. So always feel free to ask, because I know it can be a bit overwhelming at the beginning if it's a system you're not very familiar with. So please feel free to always, message me if you have any questions. But if you want, I can just forward it on the chat. Just a second. So this is the link, but I'll get you guys the presentation with all the details in it, including the links as well. Okay, so let's start off with pediatrics. So obviously the main things would be you have a GMC registration, MBBS, you have finished 12 months experience after GMC registration. Basically the selection criteria would be as here, which is basically, as I told you, a lot of the criteria, if you notice, would be very similar to what we just discussed in internal medicine. So for example, main qualification, obviously MBBS, but if you have a master's degree or another bachelor's degree, then that gives you extra points. Also, from a clinical skills perspective, they want to be able to, assess that you know how to prioritize the clinical need, maximize the safety and minimize the risk, and know how to initially manage an acutely unwell patient. And this will be through the interview, mostly. And basically the desirable criteria would be to demonstrate competence in pediatric life support, so PALS, and if you have any attended any course on level 2 or 3 pediatric safeguarding, that's also desirable. And you have experience in procedural skills in pediatrics. When it comes to academic skills, it will be through your application as well as when you do the interview. So basically they want to see that you understand research, you understand all the ethical issues with it, and you know how to conduct an audit, have an evidence-based practice, maximize the patient safety, have been involved or understand quality improvement projects. But if that is just an understanding, which can also be assessed while you're doing an interview. However, or you can do it when you write your, why do you want to apply what you have done? So you list your strength point. If you have any academic or research achievements, you've won awards in a conference, you have publications, presentation, this also all counts towards maximizing your chances. Evidence of involvement in a quality improvement or an audit or research. You show with all these involvements that you're committed to the specialty, maybe a publication about pediatrics specifically, or quality improvements or audits in pediatrics specifically. In teaching, you show either an evidence of interest or an experience, and you have collected and reflected on the feedback that you have gotten when you taught. So as you can see here, it's general, but mainly if you have the desirable criteria, you have maximal chances. Personal skills, obviously, they want to see that you have good communication skills, problem solving and decision making, empathy when you communicate with your patients, managing teams and knowing how to work in a multidisciplinary team, know how to organize and plan according to the time frame that you have, situational awareness, able to cope with pressure and manage if you're uncertain about something and who to go to and so on. the things that would be desirable would be, you know, you have been involved in management, you demonstrate an understanding of how the NHS system works, you have worked in a multidisciplinary team before, you have worked as a, you know, or you had some form of leadership role, even if it's outside medicine. And actually, if you can see any evidence of achievement outside medicine, and if you do voluntary work, any of these things, a university club, organization of a university club, sports section, all these can actually count into a desirable criteria for you as an applicant. And then, as you can see, there are things that, you know, we all as doctors should be having, and then there are things that will be an extra work from you, or something that you're doing outside the curriculum. So commitment to specialty, obviously things outside the curriculum would include courses, masters, PALS, being a PALS instructor, and so on and so forth. They want to see that you're doing things that are showing commitment to specialty. So that would be for the pediatrics. Basically, in general, as you can see, a lot of the person specification for all the specialties include very similar things. So it's all about working on your CV in terms of publications, presentations, doing degrees or courses, showing commitments to specialty, having leadership roles, having organized, you know, for teaching or for other purposes, but you had an organizational role. All these maximizes your chances wherever you go. Obviously, the more specific it is for the specialty that you're applying to, the more likely that you'll get into it in your preferred hospital that you have applied to. Pediatrics in the UK is amongst these specialties that is not really difficult to get into. So because they have shortage in pediatrics and in ER or A&E, there is a very high chance to get matched right away. And with pediatrics, it's also a run-through program that you finish in around 6 to 7 years. So this is mainly an idea about pediatrics specialty in general, on what you need to have done to get into the specialty. Any questions about pediatrics? The next one would be OB/GYN and radiology, and then I'll discuss pathology and any other specialty you guys might want. Okay, I'll move now to OB/GYN. Okay, so OB/GYN involves more or less similar criteria as an entry level, and as you can see from a qualification perspective, if you had a formal academic achievement, which is not a prerequisite to the application for obstetrics and gynecology, but relevant achievement as part of the overall assessment of the application. So if you had any kind of academic contribution or an academic course that you have done that relates to OB/GYN, it will be counted. Master's, bachelor's degree, MD or PhD should be also included. So basically here, they're just noting that it will only be considered if you're awarded for defending a thesis. This equates, again, taking 2 to 3 years, a full-time equivalent spent in research with minimal clinical activity, as most of the PhDs are. So this maximizes your chances. Relevant experience in other specialties, which would complement a career in obstetrics and gynecology, and again, having practical skills specifically for OB/GYN. Again, if you, from a research perspective, more presentations and research, more competitive. From a teaching perspective, if you had taught in general and had feedback for teaching, that counts well towards your application. And if you have an instructor status or a recommendation for an instructor status, whether it was an ALS, ATLS, EPLS, or APLS, that counts to very highly towards your application. From other personal skills, obviously, anything that shows that you have worked within a multidisciplinary team before, have done any management or leadership roles outside medicine, that always gives you extra points. More or less, as you can see, it's mainly the same concept of what you need to prepare to be a competitive applicant. And as I said before, they would expect you to have finished 24 months generally, but here in OB/GYN, they expect 24 months or less experience in obstetric and gynecology, which doesn't include the foundation years, by time of intended start date. Obviously, if you have, that's why I always say, if you have done foundation year 1 and year 2, I know we all want to jump into training, but if they see that you have an experience in an NHS, in an OB/GYN, that maximizes your chances. If you do it at least for a year, it maximizes your chances of getting in, because they know that you're aware of what OB/GYN is like in the NHS in the UK. There is application for an ST1 and an ST3 level for obstetrics and gynecology, which more or less have the same criteria. Obviously, at ST3 level, you're expected to have had involvement in many audits and research relating to obstetrics and gynecology. Expectations would be slightly higher than if you're going or entering at an ST1 level. So, and obstetrics and gynecology is also, as I'm aware, a run-through program. So you stay in the same area throughout your training. Generally speaking, here the concept of fellowship, whether it was in this specialty or any other specialty, it's not very well known, because what they do is that if you have a subspecialty of the specialty you're in mind, they will allow you to work more towards that subspecialty and spend more time in it to gain more experience. And even when you become a consultant, you have your specialty clinics that run regularly in the subspecialty that you are interested in. So that's it for OB/GYN. Again, radiology, as I told you before, more or less, they're looking at the same things. As I told you, if you have done at least one part of the board exams, it really pushes your application as well. I know it's not mentioned in any of these scoring systems, but it does add a lot to you. So if you have time to actually study and finish one of these exams, obviously don't get into an exam that you feel is above your level. If you feel like you need more experience, don't do it at that time. But if you've had some time, you had some experience, and you feel like you can do one of these exams, which can help your application, by all means do so. In radiology, so basically, roughly the criteria is, it's good if you have clinical radiology experience. So here there is a concept of doing taster weeks in different specialties. So obviously, if you have a year of experience as an trainee in radiology, that would be amazing. But otherwise, try to get, taster weeks in that specialty and work with them to see how things are like. You can do that as you're doing your job. You get it as a study leave and you do 1 or 2 taster weeks. Audits, obviously, if you've completed an audit that changed the guideline, then you get maximum points. If you did an audit that did not do any changes or you didn't apply any changes, you still do get points, but less points. Teaching, exams, research. So again, if you have organized a teaching program, you completed the teaching diploma, that gives you maximum points. If you have organized a local teaching, then that gives you intermediate points, but still gives you good points for you to get in. Research, you get more points if you have more than one publication, where you are either, one publication, or you had another bachelor's degree. If you have one publication only, you get less score, but equally. So basically, that's what you need to look into when you apply for radiology, that you try to maximize your chances, do the most of everything you can, whether it was in research or teaching. Exams, basically, they would, if you have MRCS within 4 years of you graduating, that maximizes your chances. You get less points if you did it after 4 years of graduation or finished this after 4 years of graduation. So the exact marking scheme, and that's what I wanted to tell you, because in internal medicine, I think they've noted it more, you know, in detail, but generally in other specialties, sometimes the scheme of the marking may vary from year to year, but all these categories will more or less remain the same. So if you maximize your chances in each of these, you'll get higher marks. Obviously, they will give more credit and higher marks if you have something that's radiology theme. And basically try to maximize your chances in each of these sections, but don't work on one section to maximize your chances and leave the other. Try to get good scores in all of these sections to maximize your chances of getting into the specialty. Now, generally speaking, this is a website that I want you to guys also go through, because that gives you what's the person specification for each specialty. So basically, you can just open whichever specialty that you would want to get into. So for example, pathology. Okay, as you can see, there is entries at an ST3 level and then at an ST1 level. So I'll just open the ST1 level, which is histopathology. So again, basically, I would say try with any specialties. I think you are seeing the pattern. It's all about all these extracurricular activities that you have done. So if you manage to maximize your chances from these points, you'll definitely get in. Obviously, I want you to always, if you know what you want to get into, try to have your extracurricular activities around that. So if you're doing research projects, make sure that it's around that. Not necessarily, if you can actually do that, that would be great. But I'm not saying if you do it in other specialties, it will minimize your chances. But if they see that you're working in your research on these, if you're doing audits in that department, if you're doing quality improvement projects in that department, if you have any kind of certification or qualification under that specialty, like as I told you, master's, which is 1 year here, and you can gain actually also clinical experience in some of them. If you do any of these things, and some people actually, before they get into training, a lot of people here, by the way, are not that eager to run into training right away. I know a lot of us think that if we extend that, then it's just going to be more years until you become a consultant. But a lot of people think of it differently in that they want to explore their options. They want to feel very safe by the time they start training, that they are keeping up with the system and with all these changes. A lot of people don't mind if that they become consultants at a bit later stage, if they had a bit of a taste in different specialties and based on that decided what they wanted to do once and for all. Because some people don't decide that even at that point. They would be still a bit hesitant on which specialty to go for, and that's completely fine. The reason I'm saying this is that if you still don't feel 100% sure about a specialty or a specific specialty that you want to go for, I would say explore, because at the end of the day, this is a specialty that you're going to continue with for the rest of your life. So don't see it as, okay, if I'm going to do an extra year or an extra 6 months, that will delay my training, that will make it longer. If you think of it that way, then obviously you're not gonna enjoy the entire process. But I would see it that way, that if I'm not sure, and that's specific, not specifically for people who are not sure, but generally have a bit of taste of what the specialty you have in mind is like, and how is the processes there, how is the lifestyle there. When you work as a non-trainee, you actually get a taste of that, and you will be able to then decide once and for all whether the specialty is for you or you want to do something different. So at the end of the day, don't look at the number of years that you're doing, but rather what choices did you make, and did you make a thorough, thinking process about this before you chose it, so that, once you're there, you are 100% sure that this is the specialty you want to be dealing with. Because any kind of specialty can be very hectic. As long as you are enjoying it and you're passionate about it and you've entered it because you liked it, you'll enjoy it no matter how many years do you have ahead of you. At the end of the day, the reason I'm just saying this is because this is the concept that's with a lot of us, that they want to become a consultant as soon as possible. Just think of it from another point of view, because not everyone have decided what they wanted to do. More years of experience means a more, competent consultant, safe trainee. So we need to look at it from all these other perspectives and all the other aspects where you are allowed to work less than full-time in these training schemes if you needed to. You can work 60% of the time, 80% of the time. You choose what part-time you want to do for any reason that you might have. You have, leaves, paternal leaves, maternal leaves. So that's why all these things are integrated as well. That might make it a bit longer, but it's just because they appreciate the different circumstances that people might be in. So I just wanted to give a thorough idea about that as well, and why the UK system might be slightly longer than the rest of the systems. But nonetheless, just make sure that this is the right choice that you wanted to go for before you proceed forward with it. I think otherwise I have covered everything that I can in internal medicine, as well as other specialties, as much as I'm aware of. I'm sorry if I didn't go in detail, but generally speaking, at the entry level of each of these specialties, practically things are the same. The main thing is you need to show commitment to specialty, because as I told you, all these domains that I discussed, they are more or less in all specialties, might differ in how they score them, but they make you a competitive applicant in all specialties. Make sure that they are more specific towards the specialty that you want to go for. If you guys have any questions about anything that we have discussed during this session, please feel free to ask me now. Again, I know there were a lot of information that I gave you guys. So if, after we finish this session, if you want to go through the slides and the links that I will provide you and you still have more questions, please feel free to ask me, because as I told you, it can be a lot of information all at once. So I'm more than happy to answer any questions that you might have now or later if you want to message me as well. So I'm just going to give you also 2 to 3 minutes if you have any questions about anything we have discussed today.
I think there are no questions, Doctor. Thank you so much, firstly, for the informative presentation, Dr. Lin. I'm sure everyone in the audience found it very beneficial and informative as we did, and we truly value your experience and guidance, Doctor. I'd also like to thank AMBOSS for their constant support. To everyone in the audience, thank you for joining us today, and our team hopes that you found this session as informative as we did. If you have any more questions, please feel free to put them in the chat now, or you can unmute and ask your question as well. And make sure to follow us on Instagram and Twitter, and subscribe to our YouTube channel to receive the latest updates about all our upcoming events. I'm going to put the links in the chat now. If you have any further questions or you'd like to contact us in the future, you can do so by the following link. It's for the International Office at College of Medicine. Once again, thank you so much, Dr. Lin, and everyone in the audience. And we hope to see you again in our upcoming webinars.
Thank you so much for your efforts in arranging this. Thank you.
Thank you.
Thank you, doctor.
Thank you. And again, feel free to contact me whenever you have any questions. I'll be more than happy to answer, guys.
We'll share your email once again with them, doctors.
Thank you.
Have a good day. Bye.